Truth about the 1968 Hong Kong flu. The Hong Kong flu, one of the deadliest pandemics in modern history, claimed an estimated 1 to 4 million lives globally. Its rapid spread and high mortality rate served as a grim reminder of our vulnerability to viral outbreaks. The Hong Kong flu was an influenza pandemic that emerged in 1968. It was caused by the H3N2 strain of the influenza A virus. This virus led to widespread illness and significant strain on global healthcare systems. The flu originated in Hong Kong in early 1968. Its first cases were reported among local residents, quickly alerting health officials to a potential outbreak. The virus rapidly moved beyond Hong Kong, signaling the onset of a global pandemic. The flu spread globally through international travel and trade routes. Within months, it had reached every continent, infecting millions. The speed of its transmission highlighted the interconnected nature of our world, rendering containment efforts challenging. Common symptoms included fever, cough, sore throat, muscle pain, and fatigue. These symptoms often led to severe complications such as pneumonia. The widespread illness overwhelmed hospitals, underscoring the need for robust healthcare preparedness and response mechanisms. The Hong Kong flu, scientifically known as H3N2, was a subtype of the influenza A virus. This particular strain emerged through antigenic shift, combining genes from human and avian flu viruses, making it highly contagious and virulent. First reported in Hong Kong in July 1968, the flu quickly overwhelmed medical facilities. The densely populated region provided an ideal breeding ground for the virus, which spread rapidly among residents and travelers alike. The flu spread was expedited by global air travel, reaching Vietnam and Singapore within weeks. By the end of 1968, it had spread to Europe, the United States, and beyond, infecting millions worldwide. Symptoms of the Hong Kong flu included sudden chills, fever, muscle pain, and cough. These symptoms were similar to those of seasonal flu, but often more severe, leading to numerous hospitalizations and complications. In Asia, the flu's impact was devastating, particularly in densely populated areas. Countries like Japan and India reported high infection rates, with significant strain on healthcare systems and a substantial increase in morbidity and mortality. The Hong Kong flu significantly impacted North America, particularly the USA and Canada. Hospitals were overwhelmed as the virus spread rapidly, leading to high infection rates and strained healthcare systems. Public health officials struggled to manage the crisis. In South America, the flu spread was exacerbated by less developed healthcare infrastructure. Many countries faced shortages of medical supplies and personnel, leading to higher mortality rates. Communities grappled with the pandemic's devastating effects on daily life. African nations dealt with the Hong Kong flu amidst existing public health challenges. Limited access to healthcare and resources made it difficult to contain the virus. Some regions experienced severe outbreaks, highlighting disparities in global health preparedness. Australia faced its share of challenges during the Hong Kong flu pandemic. The virus spread quickly across the continent, affecting thousands. Health authorities implemented various measures to curb the outbreak, but the healthcare system remained under significant pressure. The global death toll from the Hong Kong flu was staggering, with estimates ranging from 1 to 4 million lives lost. The pandemic underscored the need for better global health preparedness and more robust healthcare infrastructure worldwide. Healthcare systems worldwide faced immense pressure as they scrambled to respond to the Hong Kong flu. Hospitals were overwhelmed, and medical staff worked tirelessly to treat the influx of patients, often with limited resources and knowledge. Efforts to develop a vaccine were swift but challenging. Scientists raced against time, conducting research and trials to create an effective solution. Despite their efforts, the vaccine rollout faced logistical hurdles, impacting its immediate efficacy. Public health measures varied by region, with some countries implementing quarantine and travel restrictions, while others focused on public awareness campaigns. Social distancing and hygiene practices were promoted to curb the flu's rapid spread. The economic impact was profound, with businesses closing and economies stalling. Industries such as travel and entertainment were hit hardest, leading to widespread job losses and financial instability, affecting millions of households globally. Cultural shifts emerged as societies adapted to new norms. The pandemic influenced changes in social behavior, highlighting the importance of public health and hygiene. It also spurred advancements in medical research and emergency preparedness for future outbreaks. Governments worldwide faced immense pressure to respond swiftly to the Hong Kong flu. While some implemented quarantines and travel restrictions, others focused on public awareness campaigns. The varied approaches highlighted differences in preparedness and resource availability. Media coverage during the Hong Kong flu was pervasive and often sensationalized. Newspapers and television broadcasts provided frequent updates, sometimes causing public panic. The role of media in shaping public perception became increasingly evident during this pandemic. Personal stories from survivors and affected families brought a human element to the crisis. Tales of loss, resilience, and community support emerged, offering a poignant reminder of the pandemic's far-reaching impact on everyday lives. Lessons learned from the Hong Kong flu have influenced modern public health strategies. Improved disease surveillance, better communication channels, and enhanced vaccine development are just a few areas that benefited from the experiences of this global health crisis. Comparing the Hong Kong flu to other pandemics like COVID-19 reveals similarities in virus spread and public response. Both highlight the importance of global cooperation, rapid scientific research, and robust healthcare infrastructure in managing pandemics. The Hong Kong flu left a lasting impact on healthcare and policy, prompting global improvements in pandemic preparedness. Lessons from the outbreak influenced modern strategies, emphasizing the importance of early detection, rapid response, and international collaboration to manage future pandemics. Scientific advancements following the Hong Kong flu included better understanding of influenza viruses and the development of more effective vaccines. These innovations have been crucial in enhancing our ability to combat influenza and other viral outbreaks, saving countless lives. Myths about the Hong Kong flu, such as it being less severe than other pandemics, have been debunked. The high mortality rate and widespread impact underscore the importance of accurate information and the need for vigilance in public health. The lessons from the Hong Kong flu are highly relevant today as we face new pandemics. Understanding past outbreaks helps us navigate current challenges, emphasizing the need for robust healthcare systems and proactive public health measures. Learning more about past pandemics like the Hong Kong flu can guide us in supporting public health initiatives. By staying informed and advocating for strong healthcare policies, we can better protect our communities and prevent future crises. Don't forget to like, comment, and subscribe for more history facts.